You know the feeling. You're the one who always volunteers first. You constantly anticipate everyone's needs before they even realize what they want. And you find yourself apologizing when there is absolutely nothing to apologize for. It's an exhausting way to navigate the world, and it creates a profound physical friction, that deeply uncomfortable sensation of hearing yourself say yes out loud while your nervous system and your entire body are screaming no. There is a psychological paradox at play here. Mentally, you desperately want to stop people-pleasing and establish normal boundaries, but that desire immediately collides with a crushing, almost involuntary sense of responsibility for keeping everyone around you happy and regulating their moods. Society usually misdiagnoses this dynamic. We label it a fawn response, frame it as a deep-seated character flaw, or treat it as a weakness of willpower that you just need to forcefully suppress. Treating your own survival mechanism as the enemy creates a perpetual internal war. You end up fighting your own mind, which guarantees you will remain stuck, frustrated, and completely depleted. This is where a therapeutic model called internal family systems, or IFS, offers a completely different lens. Developed by Dr. Richard Schwartz, the foundational premise of IFS is that your mind is not one single uniform personality. Looking at this diagram, we can visualize the psyche not as a fixed unit, but as a system of distinct, interconnected parts. These aren't multiple personalities, but completely normal aspects of your inner world that take on highly specialized roles to maintain your internal safety. One of the most prominent roles is what IFS calls a manager. Managers are proactive protectors. Their entire job is to scan the horizon, control situations, and curate your environment to prevent emotional pain before it ever happens. Reclassifying this trait through the IFS framework reveals a highly dedicated manager part, working overtime to ensure you stay safe. Approaching this behavior as an exhausted ally immediately shifts the dynamic, neutralizing shame and opening the door to actual behavioral change. But to understand why the manager works so hard, we have to look deeper into the center of this system, at what IFS calls exiles. These are the vulnerable, often much younger parts of the psyche that carry unresolved pain, fear, or shame. These exiles didn't appear out of nowhere. They usually formed in historical environments, often during early childhood, where being your authentic self or expressing your own needs was quite literally unsafe. This is the direct link to your overgiving manager. The manager's relentless accommodating, apologizing, and peacemaking is a strategy to intercept external threats, ensuring that the fragile exile inside is never triggered. However, no manager is perfect. When external pressure overwhelms the system and the exile is exposed to pain, a third category of parts jumps in: the firefighters. These are reactive, emergency response parts, like sudden dissociation, binge eating, or rage, designed to forcefully extinguish the emotional pain by any means necessary. Chronic people-pleasing is a symptom of a highly stressed psychological ecosystem, one constantly teetering between extreme management and emergency firefighting. There is one final crucial component to the IFS model that makes healing possible: the self. This is your core consciousness, the steady anchor that exists entirely separate from and behind all of these protective parts. Unlike a manager or a firefighter, the self doesn't operate out of fear or control. It has innate, undisturbed qualities, specifically the capacity to approach your own internal system with curiosity, calm, and compassion. The true objective of IFS therapy is to cultivate this self-leadership. Instead of trying to fire or suppress the overgiving manager, the goal is to turn inward and actually thank it for its years of hard work. This leads to a process called unburdening. By finally acknowledging the manager's effort and giving it permission to step back and relax, you create the space for other parts of your psyche, the ones with their own desires, limits, and boundaries, to safely express themselves. This framework is grounded in clinical evidence. The Substance Abuse and Mental Health Services Administration formally recognizes IFS as an evidence-based practice, and it has significant support for treating complex trauma, clinical anxiety, and depression. Today, this kind of non-pathologizing care is highly accessible. Practices like Coping and Healing Counseling, or CHC, offer 100% HIPAA-compliant telehealth services, connecting patients across all 159 Georgia counties with licensed IFS-informed clinicians. Sustainable boundaries emerge when you stop fighting your internal system and extend profound self-compassion to the parts of you that worked the hardest to keep you safe.